Welcome to Business Talk, brought to you by businesstech.co.za. Now, when you think of science, you might picture petri dishes, microscopes, and lab coats. When you think of tobacco, it's probably policy debates, health warnings, and let's be honest, a fair bit of smoke. But what happens when you bring science and tobacco together in the 21st century? Well, into my guest today, Dr. Edward Makgotlho, who's Area Head of Scientific Affairs for British American Tobacco in Sub-Saharan Africa, with a PhD in infection and immunity and a career that straddled microbiology and regulatory science and a real passion for public health innovation. Dr. Makgotlho isn't really your typical tobacco executive. So today we're going to cut through a lot of the smoke and talk about the science behind harm reduction and vaping regulation, which I think is a really important and evolving area of public policy discourse at the moment. Edward, great to have you on the platform. So let's just start with the big picture. I mean, you've got an academic and medical background in infection and immunity. What brought you into the world of tobacco harm reduction and scientific affairs at BAT?
Good morning, Michael, and good morning to the viewers. Thank you for that question. Interesting journey in career. Quite a switch from my previous days from academia, pharmaceutical. I think it's the cause of harm reduction, in specific tobacco harm reduction. It's quite a niche, not popular subject. However, I believe with the evidence that's there, there's a lot of good that can be done. And that's where I come in. I'm a staunch tobacco harm reduction advocate. Beyond just a scientist, I believe in the cause. I believe in being pragmatic. I believe in science evidence. That is why I'm in this space.
Yeah, and obviously it must be a quite controversial topic when you interest yourself at a braai or a dinner party or something like that, because there's a lot of public confusion and a lot of controversy around the science of harm reduction. So in simple terms, how do you define it and why is it so important in the context of nicotine use currently?
So tobacco harm reduction is it's a strategy. So to put it, it's a strategy that's aimed at switching people that are smokers, adult smokers, into less, harmful alternatives that's out there. It's a rather very pragmatic approach to the way that things have been done before. However, there's evidence out there that has shown that these products, your vapes or otherwise known as electronic cigarettes, your nicotine pouches, and so on, have the potential to reduce the harm and the smoking rates in many other instances, which we will get into in the talk.
Now, the phrase smoke-free future has become a bit of a buzzword when you talk about that in the industry. So from BAT's perspective, what does that vision look like in practice, especially for Africa?
So smoke-free is a particular definition by the WHO. It's defined as that country that has achieved less than 5% of, the entire population of smokers. So what we see in many countries, for example, Sweden, that has taken this approach of the right regulatory framework for these products, you see a significant decline in smoking rates. You see it in countries like New Zealand. I'll get into it as well. When they allow for these products to be accessible whilst protecting underage, the right regulation, the UK, the US, you see the decline in the smoking rates in the country.
Many public health advocates remain skeptical of vaping and of these alternatives and kind of e-cigarettes or electronic cigarettes. What do the latest scientific studies actually show when it comes to the relative risk between combustible cigarettes and the smokeless alternatives?
So that's a very good question. I'll try to simplify it. It's quite complex because there's a lot of studies you can refer to. But I do think that there is space for balanced regulation and balanced science, evidence-based. You have different studies, toxicology studies, you've got epidemiology studies, you've got biomarker studies, and so on. I can go on. But, ultimately getting to a population, what you want to see is a population benefit of this outcome. So having said that, there has been studies from toxicology, and let me stick to that because it's a little easier to understand, and in the beginning of preclinical phase. So where you look at the chemicals that are in smoke, there's about 7,000 chemicals that are produced in pyrolysis, meaning the combustion of cigarette. You release 7,000. Of those, 70 are known carcinogens. Carcinogens meaning cancer-causing, right? This has been identified by the FDA. Now, when you look at those chemicals and you compare them within your cigarettes versus your vapes, they're significantly reduced in terms of biomarker and the response as well to the body. That's the first thing. Then there is another section you can look at emission, meaning that, on the other lens, you can look at what is produced. On the other hand, it's smoke. On the other hand, is an aerosol or vapor. So in these products, there's no burning at all, right? There's no combustion, pyrolysis. So it's a logic frame or a logic step to say, if you get rid of the combustion, surely you should be able to reduce the toxicants that are in cigarettes. And that's what the notion is based on in layman's terms. Much more complicated because, you have to do a couple of other, frameworks. But it makes sense. You get rid of combustion, you reduce your toxicants in these products.
Reduce but not remove entirely.
Absolutely. You're right. You reduce, but not entirely. So what you have is the nicotine base, and nicotine is what people are seeking for in these cigarettes. So how about you provide the nicotine with less reduce, without combustion, meaning nicotine in itself, I must say, it is addictive. Science has proven that it is addictive, but it is not risk-free. It's meant for adults. That's the second thing. And it's not meant for underage. And we see, and we are concerned about the current lack of regulation around these products in South Africa. But it is not carcinogenic or proven to be carcinogenic, at least by a number of entities, including your IARC, that's the International Agency for Research on Cancer, and a number of very reputable organizations out there, stating that nicotine in itself is not the cause of the disease.
And I mean, it then becomes very much like a debate around choice. Sugar, for example, we know, if you consume too much sugar, it's really not good for you from a health perspective. But I would be the last person to advocate for us to go and ban sugar overnight. It's a big industry. It employs a lot of people, and there's a balance here. And we have to respect freedom of choice among an adult population. Regulation, to your point, is key and I think quite complicated. How would you describe the current state of vaping and tobacco alternative regulation across Sub-Saharan Africa? Are policymakers keeping up with the science?
We are lacking behind, Michael. To be honest, it's quite disappointing that we're lacking behind. I would say that, that in South Africa, we are in the middle of the bill, the Tobacco Products and Electronic Cigarette Bill, which has been processed by the Department of Health. Rightfully so, we should have regulations. And I think the issue has been it's long time coming that we regulate these products, but we need to regulate them in the right way and not go backwards. Like I say, it's a pragmatic approach, harm reduction, but the evidence is out there. There's best practice. We can learn from those countries and not have to reinvent the wheel. You look at Sweden at 5.4% smoking rate. It's got the lowest smoking-related diseases in the EU, right? And that's because they took that approach. You look at New Zealand, you look at the UK, all these countries that, incentivize and encourage the adult smokers, and I must be specific here, adult smokers to switch. You see a drastic, significant decline quicker than taking a much more prohibitive and restrictive approach.
So, therefore, given those examples, given Sweden and New Zealand and what we're seeing in the UK, what would an evidence-based harm reduction aligned policy look like in South Africa?
There's a few key elements that you need in this policy that we are idealizing. Number one, you need to outlaw the sale of these products to underage, because nicotine, as I mentioned, is for adult consumers or smokers, rather. Number two, there has to be some sort of systems. We have to get on with the programs and the innovation that's out there. Mandatory verification checks, whether at point of sale, at point of delivery. You have to look at the flavors. You have to use, and flavors are very important in the conversation as well, right? But I think we need to prohibit and restrict the descriptors of, flavors. For example, you see all these ice cream flavors, all these attractive flavors to underage. You have to restrict that and focus on adult flavors. And lastly, but not least, very important, enforcement of compliance, because if you don't have enforcement, all the above mentioned is not going to do you any good. So there has to be robust enforcement of these laws.
Yeah, I mean, and we're not even having a conversation about the illicit tobacco industry, which already demonstrates that we are lacking in enforcement. Now we're talking about, regulating industry with a big bullseye on its back. I think that the youth concern is valid. And, as a father with young girls, my concern is that vaping could be a gateway for younger users, and you see it in schools, and, it partly because you say some of the flavors are designed, it would appear, for younger users, ice cream flavors, for example. So how is BAT addressing this concern from both a product and a communication standpoint as one of the key role players in this ecosystem?
So we adhere to strict our global internal, I must stress, marketing principles, and it touches on a number of guardrails, so to call them. And it goes to that position that no sale of these products to underage in markets. It goes to the marketing itself, the packaging itself. We stress a lot on quality as well, quality and safety. And I'm very glad, which is one point I missed, that as you look into the vaping industry, there's also the Vapor Products Association of South Africa. I'm sure you've heard of it, VIPASA, which has a member code, right, which we adhere to. That member code can be found on their website, that goes into the number of guidelines and a number of codes, what to do and what not to do. I think it's a start, right? Because there's no regulation. At least there's self-regulation from the industry. That is for the responsible players in the market. But certainly that is not going to curb that concern entirely. That's why we need regulation and collaboration with the government, the regulators, academia, for the science, and so on.
And enforcement, but from a scientific engagement standpoint, how do you build trust with the stakeholders, from the regulators that you're calling on to healthcare professionals, in a space that's often, Edward, emotionally and politically very charged and very fraught?
It's a difficult one. It's a difficult one. We are part of the society, and we want to do better. We want to collaborate with academia. We want to be able to talk the science without having to be sidelines in the conversation, because ultimately, Michael, a policy that does not have the right people in the room, such as the industry, that policy will fail, because the very people you're trying to regulate need to be in that room to give their input, because it affects them. So it's very difficult conversation out there. But you do see, at least you do see the light at the end of the tunnel in terms of the international markets and international, your New Zealand, your Swedish, your UK, your US, Canada, you name it, that there are healthcare professionals, scientists as well, coming to the forefront to say, hold on, there is something here. It's pragmatic, but it works. Rather than forcing people quit or die, and it is the best thing to do, quit cigarettes. But if you cannot quit, there are other alternatives out there. There's government programs as well out there that you can look at.
So finally, Edward, I mean, on a platform like this, what would you say to a policymaker or regulator who still sees all nicotine products through that same lens and hasn't yet embraced the principles of harm reduction that we've just discussed?
Plead for collaboration, plead to review the science. I plead for looking at best practice out there, and it's not industry science, as they say. Many of these are independent, peer-reviewed science out there, and evidence is quite hierarchical, meaning that you have the strongest evidence speaking to the harm reduction potential of these products. Cochrane reviews are out there, meta-analysis. You've got longitudinal data, although I do get the concern, and oftentimes I speak to some of the peers out there, and they will tell you take the cautionary principle, right? We don't have such a long data, but the science is there that we have, and we have to use balance when it comes to these conversations.
Well, thank you. I mean, whatever your views, I think, thank you very much to Dr. Edward Makgotlho for bringing some serious scientific firepower and rigor and nuance to a very complex, a very emotive issue. That's all for this edition of Business Talk. Until next time, I'm Michael Avery. Don't forget to like, subscribe, and share amongst your network.